Indianapolis area. They have about 210 employees. They spend about $350,000 a year on their pharmacy claims. We help them identify savings of about $150,000 annually. Now that's a projected savings, but in the first 2 months under their new agreement, they've already saved $24,000 in documented savings. The question that they struggle with is how much compensation is reasonable for the service they were receiving from the PPM. And until they went through the process of peeling back the layers, opening up the black box, as some of the speakers before have talked about, until they went through that process, they really didn't understand how much they had been paying for their pharmacy benefits to be administered. Now they know, and now they're realizing savings.